Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
There are all kinds of health conditions that affect all of us, no matter our gender. But did you know they may affect us differently because of our gender? The same illness may show different symptoms in men than they do in women, and knowing those differences could be life-saving. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today, we have a battle of the sexes, but we're focusing on how we can all battle common health conditions. Don't go away. Welcome back. Heart disease is the leading cause of death in America, taking the lives of more than 600,000 men and women every year. But the risks and symptoms can be different in women than they are in men. We start this morning talking about heart health with Dr. Douglas Kunzweiler and family nurse practitioner Erin Kunzweiler. Thanks for being with us today. So, Dr. Kunzweiler, maybe we could start with you. Can you first talk about what we mean when we say heart disease? What conditions fall under that umbrella?
Well, there are a lot of different kinds of heart disease. You can be born with problems where your heart's not formed right. You can have trouble with your valves in the heart. You can have trouble with the rhythms of your heart. But mostly what we're talking about is clogging of the arteries that causes what people think of as heart attacks.
Okay, and are there certain heart diseases that develop with age that we should be more aware of as we get older?
Yeah, and again, heart attacks are more common as we get older, and it's a dynamic process where the arteries slowly plug with deposited cholesterol and fat, and then a clot forms around that, and that cuts off the blood flow to part of the heart, and then that muscle dies if it doesn't get fixed in time.
Okay. Does heart disease develop differently in men than it does in women?
The process is the same in both, although it tends to develop later in women. They get some protective effect, we think, from estrogen, but the process is the same. However, women often have slightly different symptoms than men do.
Okay, so you mentioned the heart attack. Let's talk about the symptoms for that. First of all, the similarities. Men and women can experience similar heart attack symptoms. What are those?
The main thing that people complain of is chest pain, or sometimes they'll just say heaviness or tightness. It feels like there's an elephant sitting on my chest. They may also have shortness of breath. They may have nausea. They may feel lightheaded. They may break out in a sweat. And the symptoms may be experienced in other parts of their body, the neck, the jaw, the shoulders, the arms, for instance.
Okay, and then what are some of the symptoms that might vary depending on your gender?
In women, their symptoms tend to be more subtle. They don't complain so much of chest pain. They complain more of shortness of breath, feeling lightheaded, or heaviness. They're less likely to complain of pain the way men do.
Okay, I read that women complain of or often suffer what's called a silent heart attack. What is that?
Basically, that's one without chest pain, where they have dizziness or they have shortness of breath, or maybe they are just sweaty and don't feel quite right, but they don't have the classic chest pain that we think of.
Okay. So what's your advice then for both men and women who aren't sure whether their symptoms are a heart attack?
Well, anytime you're worried about that, you should seek care. And the best way to do that is to call 911 and have an ambulance come. Our medics are trained to diagnose heart disease in the field, and that's really the quickest way to get the care that you need.
Okay, great. So Erin, maybe we could turn to you now and talk a little bit about strokes. Heart disease can lead to stroke. Is there a difference between men and women when it comes to stroke?
Women are more likely to have a stroke, and some of that correlation is with age. Women tend to live longer than men, so we have a higher incidence of stroke. But the risk factors for heart attack or stroke are really the same for men and women. And I think it's important, Doug had said, about calling 911, but the other thing For prevention in regards to stroke or heart attack is seeing your primary care provider on a regular basis so you can identify risk factors, whether you're a woman or a man, and treat risk factors to prevent a stroke or heart attack from happening. So whether that be if you're diabetic or have high cholesterol, overweight, things like that, I think prevention is key to prevent people from ending up in the ER.
Okay.
So.
Great, and I understand too that women become more susceptible to heart disease or heart issues after menopause because of the role that hormones play. Can you speak to that a little bit?
Yeah, menopause doesn't cause a heart attack. We think there might be a correlation. Estrogen has an effect on the lining of our blood vessels, making them more elastic and flexible. And when we lose that estrogen and that effect goes away, the risk goes up. But some of that too is age-related,
Okay, and as you mentioned, the good news here is that heart attack, stroke, they are preventable. Heart disease is preventable. Is there anything else that you would throw out to folks of what they can do to make sure they prevent a heart, or at least help prevent a heart attack or a stroke?
I think the basic things that we talk about, healthy diet, physical activity. There's been a lot of research on sedentary life, and moving daily is really important.
Okay.
Some of the biggest risk factors are smoking, diabetes, high blood pressure. So if you're a smoker or you live with a smoker, you should do everything you can to reduce your exposure to that. And you should see your primary care physician to take care of diabetes or high blood pressure if you develop those conditions.
Okay, great. Are there things that women should be doing more than men, or men should be doing more than women, or is prevention the same regardless of your gender?
I would say pretty much
think
the
it's the
same.
same.
Yeah. Okay.
Yeah, there's not a lot of difference when it comes to prevention.
Okay, perfect. Well, that's all the time we have for that topic. We've tackled the big one by addressing some of the things that come with heart health, but we're just getting started. Next, we'll talk about another major health issue that affects both men and women, cancer. So don't go away. We'll be right back after these messages. Welcome back. When it comes to your health, men and women can often face different challenges for common illnesses or conditions. Today we are discussing some of those differences. Dr. Douglas Kunzweiler and Erin Kunzweiler are still with us to talk about them, so thanks for sticking around, you two. So Dr. Kunzweiler, we talked about heart disease, and as you know, that's the number one leading cause of death in the United States. The second one is cancer. Is one gender more susceptible to cancer than the other?
No, I think people of all ages, people of both genders can be stricken with cancer. Tends to be more common the older you get.
Okay. Are there common types of cancer that impact men?
Yeah, prostate cancer is the leading cancer in men. Lung cancer is number 2, but lung cancer is the leading killer of cancer deaths in men. And then colorectal cancer or colon cancer is also very common in men.
Okay. And Erin, how about common types of cancer among women?
So breast cancer, lung cancer, and colorectal cancer
Okay.
are going to be the 3 most common in women. Just to add into that, though, there is cervical cancer too, and we do have screening for that with Pap smears. So I think that's important to mention as a preventative measure.
Okay, great, thank you. So you both mentioned lung and colorectal cancer that has an impact on both genders. Can you tell us things we can do to help lower our risk for those? Let's maybe start with lung cancer.
Yeah, far and away the most important thing is to stop smoking, stop your exposure to smoke if you're around secondhand smoke. Some of them are related to work-related things like exposure to asbestos, but far and away smoking, use of tobacco products of any kind are the most important.
Okay, and then what about colorectal or colon cancer? Are there things we can do to avoid the risks there?
I think screening is important, knowing your personal risks with family history, because if you do have a first-degree relative with colorectal cancer, screening should start earlier than the recommended age for 50. So knowing your risk factors, alcohol use, also we talk about smoking a lot, but alcohol is linked with cancers also.
Okay. Okay, so I think we've all heard that smoke and tobacco are bad for you. What exactly is the tie-in with alcohol and cancer? Do you know that?
It's clear from studies that alcohol is associated with higher incidence of many different types of cancer. And there are some very recent studies that show that it really doesn't matter much what degree or how much alcohol you drink. Even moderate consumption can be associated with higher rates of cancers.
Oh, okay. So let's go back and talk then about the cancer specific to men or women. Erin, can you talk a little bit about risk factors that make women more, I guess, a better candidate, for lack of a better term, for breast cancer?
Yeah, for breast cancer. So there's a number of risk factors. Early menarche, or when you started menstruating, so before the age of 12, or late menopause. And this has to do with your exposure to estrogen. Not having any pregnancies, or having pregnancies later in life. Certainly family history and genetics, smoking, alcohol use. There's not that having dense breasts is a risk factor, but knowing if you have dense breasts, they can make mammograms a little more difficult to read. So again, back to, I think it's important knowing your risks and seeing your family provider on a regular, yearly basis is important. And I cover all the risk factors.
Yeah, you got all the big ones.
Yeah.
So a lot of those risk factors are very specific to women, but men can get breast cancer too, right?
They can. And they typically present with a lump. And so it's not really different so much as far as the presentation with women. Men tend to put things off in regards to their health care more than women. Sure. So a lot of times they're presenting at a later stage, sometimes with bloody nipple discharge. But
okay.
Do you have anything to add to that?
Well, it's not very common, so I think men don't think about it.
Sure.
But if they have a lump that is new, they should have that investigated.
Okay. Well, and then let's keep talking about men. The number one cancer in men is prostate cancer. What are some of the common risks there that men should be aware of?
The main one is genetics. If there's a family history of prostate cancer, then there's more chance that you would suffer from that. And we know that African American males have a higher incidence of prostate cancer than the rest of the population. So if you have a family history, then you should see your physician and get screened early.
Okay. And so those are risk factors that, they can't do much about. It's their genetics. So any advice that you would make sure you would want men to know?
If you have symptoms, especially if you're having trouble emptying your bladder, then you should see your provider. And again, as with all the other cancers, we talked about smoking and alcohol are risk factors that are controllable.
Okay. And is that the main symptom for prostate cancer then, having trouble?
Yes.
Okay.
Yes.
All right, great. Anything else just in general for men or women that they should know about when it comes to helping prevent their chances of getting cancer?
Genetics plays a role, but I think we have to remember that our lifestyle choices are really important, and sometimes can overpower the genetic part of it too. So all the things that we talked about as far as managing our risk factors, smoking, alcohol, physical activity, healthy dietary choices are important.
Okay, great. Anything to add there, Dr. Kunzweiler?
No, she covered everything.
Perfect. All right, well, that's great because we need to take another break. But what are some of the other differences when it comes to men and women's health? We still have a lot more to talk about. Don't go away. We'll be right back after these messages. Thanks for staying with us. We are talking about the health conditions that affect women and men differently. After a discussion on stroke, heart disease, and cancer, we are now shifting to more general conditions that impact our health depending on our gender. So thanks for staying with us, Dr. Kunzweiler, Erin Kunzweiler. Let's talk about men's health. Is life expectancy really that much less than it is with women?
It is. It's about 5 years or so less for men than women.
And why is that, do you think?
Well, part of it is men have a higher rate of death from trauma, especially young men, more motor vehicle accidents, motorcycle accidents, hunting accidents. They have more deaths associated with the work that they do. In general, men tend to do the more dangerous types of work, and so that plays into it. And then men tend to die younger of cardiovascular disease, heart attacks, and strokes, and so the net result of all that is that men tend to live shorter lives than women on average.
Okay. And I understand too that men are about 3 times more likely to die from suicide than women. Can you talk about that a little bit? Is that mental health issues, depression? Why are so many men?
Well, we think that depression rates are probably about the same among men and women, but men are more likely to act on it and actually kill themselves. And some of that has to do with gun access and that kind of thing. But it is true that men are more likely to suicide, especially middle-aged and older men. And alcohol is often a factor in that as well.
Okay. So what's the solution there? What should men do to get help, or why are they not getting help and turning to suicide?
Men are less likely to seek help for depression. I think there are attitudes that are in our society that men are supposed to be strong, and it's a sign of weakness if you cry or you feel
Sure.
down. You're supposed to just suck it up and keep going. So I think if you feel that something's not right in your life, you should go talk to your primary care provider about that, and they can do screening for depression and get you some treatment.
Okay, great. So men are higher in suicide rates, but women are actually higher when it comes to depression. So maybe
Yeah.
Erin, could you take that one on a little bit? Why do you think women are
Yeah.
higher in depression?
Well, I think the incidence of depression, as Doug was saying, is fairly equal, but definitely I think more women seek out treatment for it. And again, probably because there's still a stigma about mental illness in our country. And there is, good treatment for depression, both pharmacological or medications and counseling. And I think too, a lot of symptoms of depression, we think of the common ones, you feel down or you're having crying spells or hopeless. But a lot of times symptoms are physical, so lack or inability to sleep or sleeping too much or lack of appetite, weight gain, weight loss, even headaches and stomach aches, that don't have another etiology for. So I think, in general, women seek treatment for all of those kinds of things, but I think it's important to know that that the physical manifestations may be the only ones you have, and I would encourage men and women to seek treatment for those.
Okay, great. Thank you for that. And so we talked about that women do live longer than men. Are there other health conditions or issues that affect women more than men, especially as we age?
I think we tend to screen women more for things like osteoporosis, for example, but men get osteoporosis, just as much as women do. So I think it's important, really, as opposed to separating, to think about, that we need to be looking at both genders equally with those kinds of diseases.
Okay.
Are there any ones that you can think of?
Well, osteoporosis, I think, is one of the big ones that we think of as being exclusive to women, and certainly that's not true.
Right.
Men, have a lot of trouble with their emptying their bladders as they get older, and so that leads to a variety of things that women generally don't suffer from. And I think women have a lot of pelvic conditions because of their different anatomy that they get into as
and
they
even going
age.
back to depression, I think we have to remember with women that there, is perinatal depression, postpartum depression, there can be postmenopausal depression, so things that are more unique to women because of those life changes, that men don't have. But again, back to that with pelvic issues and urological issues with women, just because of the nature that, you've given birth or whatever, that's more unique to women as we age. than men.
And I think, you know, we talk a lot too about hormones with women because of menopause and some of the other things that they go through with estrogen, but there are things that men can go through with testosterone too, right? Health issues that happen if testosterone goes down, those kind of things.
Yeah, and there are things that are actually caused by trying to treat another condition. Men with prostate cancer are given drugs to counteract testosterone, and that can lead to problems, osteoporosis being one that comes to mind readily.
Okay. Maybe we could talk a little bit more about prevention. Are there different preventative, I guess, recommendations or guidelines when it comes to men or women, especially when we talk about vaccinations?
So no, in regards to vaccinations, and I'll just go through, you know, the recommended ones. We recommend getting your influenza vaccination on a yearly basis. We recommend the shingles vaccination starting at age 60, and there is a new shingles vaccination that has just come out, and it is supposed to be more effective than the previous one, so that it's recommended to get that one even if you've had the previous shingles vaccination. There's 2 pneumonia vaccinations starting at age 65 that men and women should get, or they should get it earlier if they have underlying diseases like chronic lung disease or diabetes.
Shouldn't forget tetanus. You should get a tetanus
and your
booster
tetanus every 10
years.
years, and that has the pertussis in it also. So,
And there's no real difference between recommendations for men and women as far as I know of.
Okay.
We've
not for
vaccinations.
vaccinations.
Okay. And we've talked a lot too about prevention as far as healthy eating and not smoking and watching your alcohol intake and those kind of things. Are some of those recommendations different? Obviously, we know men are built differently than women. So what are some of the recommendations there as far as exercise, healthy eating?
I think for women, we start losing our bone mass in our 30s, and we don't really start thinking when we're 30, you know, about osteoporosis when we're 70. So it's really important even for younger women, you know, to have a good intake of calcium and vitamin D and fruits and vegetables and fibers. And for both men and women in regards to physical activity, when we know moderate physical activity most days of the week is a reasonable guideline to use, but I would encourage people to incorporate weight training into their physical activity regimen for prevention of osteoporosis.
Helps to prevent falls too. It's been shown that if you carry more muscle mass into your later years, you're less likely to be bothered with falls and fractures.
Physical activity for all of the things we've talked about, heart disease, stroke, and cancer, is a good prevention for all of those.
Perfect. Okay, thank you very much, you two. We're out of time, so that's all we have for this week. We hope you'll join us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.